Years.
Looking for some thumbs up. Who's attended something before? Because I recognize a whole lot of the names.
And if you haven't, maybe just do a smiley face because we're happy to see you.
Fantastic. Seeing some thumbs up and smiley faces. Well, as we were welcoming everyone, you noticed that it said that this meeting is being recorded. Please know that we record all of our summer series. They will be available on the webpage, for which Angie will send an email or share the link to make sure that you can then afterwards access or share this information with anyone related. A copy of this presentation will be provided to you all. So we just want to make sure you know that you will have access to anything and everything that you need. All right. Well, if we can go to the next slide, thank you very much. In our time together today at the ECI Summit, you know, we talked a lot about onboarding, kind of in between. What are we doing to recruit? What are we doing to keep people? And what that onboarding process looks like. So today is an extension of some of that dialogue. And so our specific objectives for today is to continue to kind of delve into that understanding of the onboarding process, to include an indication of what are like state requirements, agency requirements, what are some things that we internalize in that process to help set individuals up for success related to your specific processes. We're going to also incorporate into this some specific goals for onboarding. Dana is going to share with you some information from best practice and the literature. And then what we'll do is, in talking about the components of a structured onboarding process, we're going to relate that back to what we do daily, weekly, and discuss what works well, what are some challenges, and what are some changes that you would like to see, things that you can control within your agency, things that we might influence at other systems levels. So I'm going to hand it over to Dana.
Sounds good. If Dana can find her unmute button, she'll be ready to go. So here we are. Well, it's so good to see you guys and see the familiar names in the chat and or in the participant list and on camera. I am not able to see everybody on camera because I'm sharing my screen, but I can see a lot of you. But we want to invite you guys to use your chat to make comments, to ask questions. If it's easier for you to unmute your mic, you're welcome to do that. And we're going to, like Elizabeth said, we're going to do some reflecting. So we'll have time for you guys to chat with each other in some breakout rooms in just a few minutes. But before we go there, we wanted to get all on the same page with what this phrase onboarding means, because it's a phrase that's relatively new. It's used more in like the business sector than probably in education or, you know, special education or the kind of work that we all do. So I thought we'd start with a shared understanding. So onboarding, as you see in this definition, goes by other names. You'll see induction, you'll see orientation. Some programs even call it like initial training. But as you're going to see, onboarding often includes training, but it's about a lot more than that. It's a process that's designed to help the new employees that you hire integrate into your organization and transition from being the newbies that don't know a lot about what they're getting into, because that's the nature of getting a new job a lot of time, to being a productive member of your team. So let's think a little bit about, what do we know about onboarding? Let me ask you guys, you can write it in the chat. Is onboarding a phrase that's familiar to you? Like, do you use that in your program, or do you have another term you use for that period of time where you're transitioning from hiring someone to feeling like they're ready to go see families. What do you guys call that period of time? Do you call it onboarding, induction, orientation? Kelly says they use onboarding. Okay, Crystal says orientation, onboarding. Okay, Jennifer, so you guys are using that phrase. If there's any other word you guys use, feel free to throw it in there. Sometimes you think headache because it can be a long process. You can use it and then somebody leaves and that's not fun, right? So a lot of work goes into onboarding. So onboarding, training, orientation, new employee orientation, Nisha, I see that one. Okay, pre-service training. So Rhonda, yeah, pre-service training can look like different things. I've worked in programs that used training as like the word too that described this process, but it sounds like we're all in the same ball game for like what phrases we use. So Crystal says orientation is more for the HR stuff as an organization. Onboarding is the program specific information. So thanks, Crystal. So that's helpful to think about, like even within this process, we might have different words to describe what different people are doing. And yes, we've all sat through the HR orientation where you get to hear about the mission of the organization and all of that stuff that we just all have to do. Like y'all have to learn about that stuff. But it actually is important that employees understand that stuff, mission and values. And as I was reading through the literature, I was sort of surprised to see that that's a component of that orientation or onboarding that's sometimes overlooked, like having that shared understanding of your mission. And in fact, some of us, I've trained other leaders in other states, have thought, we need to really define our mission. So something to think about when you're thinking about onboarding those new folks. So here's some interesting stuff I found in the literature. So onboarding is associated with higher employee engagement when folks are onboarded successfully. And we're going to talk about what's important with onboarding. They tend to later on have better job satisfaction and they stay. So more long-term retention, which makes all of that effort worth it, because we all know how hard it is when you invest in somebody new, you invest in the hiring process, you invest in getting somebody oriented and onboarded to your system. And then they go, this is too much driving. This is too much paperwork. I'm out of here. And that's a really hard hit for a program. We also know that a strong onboarding process is a good investment for developing loyalty to your agency, and loyalty tends to be associated with better retention and positively impacting productivity and performance. So productivity, performance, maybe aren't words we use a lot in my state. They aren't. How would you guys define that when we think about we want to have some positively impacting productivity and performance? What are we looking for in employees for productivity and performance? How would you guys define that? Let me know in the chat. What is productivity and high performance in early intervention? I know sometimes productivity can be measured by like the number of direct service hours, things like that. How do you guys measure those things? What are you looking for? The chat has gone quiet. Let me give you another example. So when I was a supervisor, performance, one thing I was looking for is family satisfaction. So we would kind of randomly make calls to families and just check in. How is it going for you? How do you feel about it? How is your developmental service provider or your early intervention specialist? How's how's PT going? And we would just check in, which was a way to know that like performance not only meant the numbers, the hours of families you're seeing every week, but like, are children having positive outcomes or families satisfied? Yeah, you guys have popped it in the chat. Thank you. You saved me there. So Nikki says, after 90 days of employment, we use direct service hours. So 50% of the time work, they should be seeing families. So sounds like that's pretty similar here, numbers of hours delivered. So those kind of things are like quantitative, right? They're numbers we can count. Then we also have to think about that quality, right? That piece of it. Okay, David says accuracy and timeliness of documentation. Absolutely. Are you getting your documentation in on time within whatever your guideline is for how many numbers, we have in Virginia, I think some organizations have like within 2 or 3 days of the visit. Percentage of planned versus delivered time, total face-to-face hours, performance, meeting state requirement, performance measurement. So Rhonda reminds us that it's sometimes above our agency level, right, at the big picture. And Crystal says service delivery, understanding of job duties, ability to complete documentation, report on satisfaction, and meeting deadlines. So Crystal's kind of put it all together for us. So onboarding is a good investment in all of that. Onboarding is also closely related to employees' sense of belonging and morale. And I hadn't thought a lot about the sense of belonging before I was reading about onboarding. I mean, because I think it's like early intervention, we're kind of a community, right? It's often a small community within a larger, maybe, larger agencies. But some of the research in onboarding found that employees' reported sense of belonging makes a huge difference in their retention and, of course, their morale. We know that low morale is not uncommon in EI when we have staff shortages and the challenges that we can certainly face. So we wanted to give you guys a little bit of time to explore what onboarding looks like for you in your agency and chat with others that are in similar sized agencies. So we're going to move you to breakout rooms or give you the opportunity to go to breakout rooms in just a second. And we want you to chat about what is the onboarding process like look in your agency? What are the requirements? Who does what? So we even saw in chat, some of it is HR does this stuff. Some of it maybe you do as a manager. And how long does that onboarding process typically take? So I'm going to open up, let's see, I'm going to open up 4 breakout rooms, 5. Well, we have 30 people. Yeah, I think I'll just do 5. And so here's how we're going to do it. Rooms 1 and 2 are smaller programs. So when you have the opportunity to join a room in just a second, you can join a room to talk to others who have smaller programs. Rooms 3 and 4 are going to be our larger programs. So if you're in a larger program, look for room 3 and 4. And then room 5 is for whatever you want to go to. That's a mixed size room. So say you get in a small group program, a small room, and there's like a lot of people in there and you want to have a smaller group, you guys can move where you want to be. So rooms 1 and 2, small programs, rooms 3 and 4, large programs, and room 5 is a mixed, if you're somewhere in the middle. So when you get there, you'll have about 10 minutes to discuss your onboarding process. Identify somebody in your group who's willing to, when we come back to the main room, to just share a brief summary of kind of the themes you guys noticed in your discussion. So with that, give me a thumbs up if you feel clear on what you're doing. If you need more clarification, unmute your mic or tell me in chat. How are you feeling? You okay? Lindsay, Amy, Patty, Deborah knows what they're doing. Okay, awesome. Dana, I don't know how you're doing that, but all the thumbs up going across, that's really cool. I'm not sure how that's happening, but awesome. Anisha did it too. Like there's a whole lot of thumbs up happening there. All right, let me open the breakout rooms. So you can pick your room. We'll bring you back in about 10 minutes. All right, the rooms are open. We'll see you back soon. So rooms 1 and 2, small groups, 3 and 4, large groups. Thank you, Elizabeth, for putting that in the chat. 5 is a mixed group.
When they're in the breakout rooms, they should be able to see the discussion prompts, correct?
They will not be able to see the slide, and they might not be able to see what you put in chat. So
Okay.
just when they
But
get there.
I went ahead and sent something to the rooms with the
Thank
questions.
Oh, great.
Mhm.
Thanks, Angie. So it looks like we still have some folks to join. If you're still in the main room, you need to click an option to join one of the breakout rooms to join a discussion about your onboarding process.
And Dana, I'll go to the small.
Okay. You're going to just check
For
in
the
on that
big.
one.
And Bev and Chris and Angie, we just invite you to pick a breakout room and listen or participate as you wish as well.
I'll go
I have
ahead.
no idea how to move to a room.
Okay, so if you go to where the 3 little dots are that say more,
Oh, okay.
there's an opportunity for you to
Now I see it.
choose to join a room.
Okay, here we go.
Perfect.
And Kelsey, if you have trouble, we can always move you too.
I'll go into room 4.
Okay, thanks, Angie.
All right, I'm gonna go and
Yeah, I was gonna add the culture and belonging piece of it. But I think you covered a lot of what they go over in those first 2 days.
Mhm.
So that's kind of
I was gonna just say, at the Harris Center here in Houston, Harris County, we do this similar. We have, but our onboarding with the agency is about almost a week. So, and it includes multiple online trainings. So they do
Okay.
some in person, all of the setting up email and all that stuff, learning about the culture, learning about values and all of that. But then it also includes like a lot of online trainings too. CPR, first aid is done. Some stuff on suicide. Some of that base things, like all new employees go through it, and then they come to ECI.
So now that you say that, Rhonda, I probably didn't describe it but they usually do CPR like the Thursday of the first week, kind of if it all works, depending on if sometimes with part-time staff we have to, but there is a lot of online training that's done. I didn't include that into the 2 face-to-face onboarding days, but I'm sure some of that happens within that first week or month as well. On the Wednesday following the new hire, they go to like our ECI department with Child and Family Services, and that's when they really start learning, here's what I need to do in the next 30 days to be able to see kids on my own in this short kind of.
So is that period of time with ECI, is that 30 days of training for the new employee once they come to you?
Yeah, since they have to have their, the making it work and their demonstration and kind of the ECI specific training and requirements, they learn about that on Wednesday of their first week of hire.
And then after that, what happens? Do they do other trainings, or what happens to them?
Yeah, on that Wednesday, they receive like who's going to be their mentor and what their schedule will look like for the next about the next 12 weeks, what their schedule is going to look like as far as training, meeting with their team, doing field visits, when they're going to demonstrate on their own, when they're going to pick up kids on their own.
Yeah.
And then when they'll come to like face-to-face classes, when they'll have, so they kind of have a heads up. Since we are such a large program, they really want to know when they have to travel into Fort Worth for the most part. Yeah.
I think that sounds similar to what we do too. Once they come to us from the HR, then they have a schedule of in-person training modules, and they have the observations for all services. All of that happens over like probably 8 to 12 weeks. So it just depends on the discipline. For therapists, it's a little bit shorter than it is for the EIS, but it's about 8 to 12 weeks before they get a caseload.
That's good. Okay.
When I came on, I've only been the director at LifePath for going on 2 months now. So when shortly after I came on, beginning of the year, LifePath determined that we would have a training resource center. So we sent a subject matter expert who was our training person from ECI into the training resource center. And basically we do similar to what you guys are talking about, where we have that first week of we call it onboarding, where they come in, they do what we call the LifePath experience. They learn all about the programs that we have, kind of the lay of the land and our values and mission and the vision for the program. And then that first week is CPR and all of the things that you guys are talking about, the things that you have to know. And we have our Relias trainings that they do, the online trainings for the required things. And then the next week is shadowing. And they come back into the office on that third week, and we have some check-in. We call it a director's corner on that Monday of the third week, where they check in with all the directors. We're just looking out to see how you doing, how you feeling about, being here, are you overwhelmed? Because it's overwhelming. And a few months ago, our chiefs had determined that we would have about 10 hours, 10, 12 hours of trainings that all of the center, everyone in IDD, BH, and ECI, we all have to do. It's integrity training and things like that, like person-centered care, care coordination, those kinds of things. So it's a pretty extensive training, and like you, Rhonda, we have kind of a long time before we start giving them a caseload. We sort of a graduated thing, 6 to 8 weeks before we expect people to be proficient enough going through making it work and all of that, and just kind of doing the trainings with their training manager and then meeting with their supervisor. It's lengthy. I think over time, like everybody else, we've learned you don't want to pile too much on someone when they're coming in.
How many, what does a caseload start? What do you start with for a caseload for an EIS?
I think it differs on the area, but we try to graduate it eventually.
I'm just jumping into different breakout rooms.
Oh, okay. Just thought I'd be here in case you need me. I'm going to pull people back or give them a 1-minute warning in about 2 minutes. Or about a minute and a half.
She's probably more hands-on with it than me. They pick up about 5.
Hey, Angie.
Yes.
I just realized when you leave the main room, the recording stops.
Yes.
And then it resumes when you come back in. So I just wanted you to know in case that affects the final, recording.
Right. Yeah.
Okay.
It's recording the breakout room. So that's why I was trying to go into a different one for that.
Oh, okay.
So be back.
It's 1 to 2 weeks of observations. I call it kind of their observation weeks, where they're observing all of our staff, the therapist and the EISs and the service coordinators. And then they have like a demo week with me, where they're getting out there, they're starting to, see kids, they're doing evals. And I'm kind of not next to them, hanging out for a little bit, usually 1 to 2 weeks. And then from there, I'm meeting with them, saying, 1 to 2 hours a week. And we're reviewing. We're looking at examples. I'm walking them through, their first periodic review, their first annual, because it's the same, they don't retain it. And so as they're doing it live with their own kiddo, I go back and we look at, each of their reviews, each of their notes, things like that. So it's a process. And then keeping them on, with me at least an hour a week for supervision for at least their first 6 months. And then I kind of dial that back depending on the person.
I think to me, Dr. Beavers, one of the key things that I hear over and over again from all directors across the state is what Megan and Kelsey were talking about, and that is that need for repetition. And knowing what we know about adult learners,
Yes.
we do all understand that need for
The process.
and for putting information out.
Well, welcome back. I think we got most everybody back. That's awesome. So you guys can X out of your breakout room window if you still see that. Well, I hope you had a good discussion. All I could see on my end were the microphones lighting up, and it looked like there were it was a lot of good discussion. So I love that. I wish I could have given you more time. I always feel like when people spend the whole rest of the last 60 minutes, they were either talking about something like seeing the Wolverine movie this weekend, which was really good, Angie and I were talking about, or actually talking about the onboarding. So I hope you had a good discussion. So I think I'm going to ask, we had 4 groups and some pretty, I know our group number 2 was pretty big. If I would love to have you some of your group, there's the timer. I was thinking have your group leader unmute and just take about 2 minutes to give us a quick summary of what group 2 talked about. So group 2 was our small group.
Okay, that's me, I think.
Okay,
This
great.
is Charles C. Flynn
Charles
from
C.
Wichita Falls. Hey, Dana. From Wichita Falls, with Helen Farabee Center's ECI program. And y'all didn't give us enough time, really,
I
because
know.
we're talkers. We are talkers. But yes, so actually Megan Megan is from West Texas Centers. We got in there earlier than everyone else, I think, and we had already started a conversation about our rural programs, and they're covering 23 counties. So smaller in numbers, but huge in size.
Yeah.
And geographically, just can't even imagine the challenges that they face. And then our program covering 10 counties, but most of those counties being rural. But we talked about someone else joined that was with a behavioral health center, and we talked about the differences in the onboarding.
Okay.
What the agency does versus what we do as ECI leaders, and talked about that dual process there, how many days that can take.
How many days did you guys find, Charlesie? How long does that process take for
Well,
across your group? What was the range you heard?
Yeah, it is definitely varied. And for
Okay.
example, our HR department really does take care of all the necessities before someone is hired, such as fingerprinting and
Yeah.
checking of transcripts, things like that. And then the initial orientation with the agency is 4 to 5 days
Okay.
before they come to us in ECI. And someone else with the behavioral health center mentioned that they spent 3 days initially with their agency training before coming to the ECI program. And then when in the ECI program, I heard anywhere from 2 months to 3 months roughly for the ECI portion.
Okay.
To, for the new staff member to feel capable and able to take a caseload where they sort of kind of know what they're doing.
Thank you, Charlesie. I appreciate that. So you kind of saw
Yes,
some
ma'am.
ranges. Yeah, some ranges depending on what kind of agency it was.
Mm-hmm.
Thank you for that. Let's hear from group 3. That was one of our large groups. Is anybody like, I can't remember what button I pushed. I'm not sure if I was in group 3 or 4, because that's kind of normal.
We were group 3, but this is Dana Dodgen. I don't think we elected a leader, but
I guess you're elected.
So it was good. We, Edgar shared a lot of being part of a larger, program, MHMR program, I believe, Edgar, but, and then as well as the other one in our group from a large program. So yeah, just really hearing about, the same kind of thing. Their agencies take on a lot of that initial process for the agency, which can in some cases take longer than like 1.5 weeks onboarding with their agency overview before they come to ECI portion of things. And then from that point, we were similar. I was just sharing, there's, for me, complications being a very large program, but a small private nonprofit. So I don't have the large agency inner workings and processes in place to do that for us. So
I see. Yeah.
Our processes tend to look a lot faster because we don't have that, which in some cases I think is, pros and cons to that. But
okay. So some differences in how the agencies work with the size and all too.
Right.
Okay. Sounds good. Did you hear anything, Dana, in terms of like in onboarding activities that you guys had in common? Like where you, typically like they meet with the manager. It sounds like they do the HR stuff. What kind of did y'all hear talk about the activities of onboarding at all?
Yes, I think, there are similarities in terms of just, obviously the online kinds of trainings we do and that are required. And then observations that staff members do, and then, you know, debriefing after that. And then sounds like the three of us have, you know, sort of mentors in place that they're assigned to follow up.
Okay.
So those kinds of things were very similar.
Okay. All right. Thank you. Thanks for jumping into that, Dana, even though you weren't elected. I appreciate that. It's always nice to have another Dana in the group too. I'm a little partial. All right. Let's hear from our other large group, group 4. And you guys, when group 4 comes in, let me know if it's similar or different things than what you've heard so far.
Well, we also didn't elect the person either, so I'll go ahead and speak for us.
Thank you,
But
Rhonda.
yes, it sounds really similar to the other.
Okay.
We had really similar processes with spending a week with the agency onboarding, just getting all the preliminary stuff done, and then coming to the ECI program and spending anywhere from 8 to 12 weeks
Okay.
of training, including in-person trainings, observations, demonstrations, online trainings, you know, just getting to know the team areas, getting a mentor, you know, having a schedule that they go through. But it's all similar with the same. And then starting out with a small caseload. Anywhere after that, like 8 to 12 weeks of training, starting with like 5 to 10 families to work with, and then gradually building from there.
Okay. Yeah, that's really interesting. Thank you. So a lot involved, especially when you get to the ECI part. It's a complex job. So a lot of components involved to get people to where they're able to take the ball and run with it. Thank you, Rhonda. I see lots of head shaking there. Oh, Elizabeth, did you have something you wanted to add?
So related to that, I wanted to chime in because in group 2, we were just starting to talk about when our time ran out. But a couple of people made the comment about how in their onboarding process, they're making revisions and having to loop in a lot of retraining. So they hear something, then they do the observation, they do this. And so they're having to create those opportunities for retraining because sometimes initially they don't retain it all. So kind of get all that information, but then once it becomes real. And so I thought that was a really great comment that Chelsea made right before we were ending. Charles, and I can't remember who else, Megan, I think, made right before we were ending, how critical that piece is to the onboarding.
I think so, you know, and you think like we've talked about adult learning in the past, and it's really hard to truly learn and remember something if you don't have context. So you might be learning something, say you were a school teacher or an adult OT for adults, then you come into EI, you might not have the context to apply all that stuff you're learning with online modules and things. We see that in Virginia a lot too. And then once you actually get your feet wet in the work, you're like, oh, now I need to really understand coaching or really understand that stuff. And I have to go back and revisit it. So thanks for adding that in, Elizabeth. Let's hear from our last group. This was kind of our mid-sized group, group number 5. Did you guys have anything similar, things you're hearing, differences that you came up with in your group?
Well, I don't think we selected a speaker, right?
That's okay.
But from what I heard and in the conversation, it seems like we heard a lot of the same things that you all have already mentioned. And I think just that onboarding process is so long at the beginning, and then it really takes a long time for the person, the new hiree, to actually be fully committed to the program. So it could take up to 6 months before they're actually producing what's expected.
Wow, and that's a long time, a lot of investment in somebody, right, to get to that point. For sure. Thank you, Beverly. Anything else? Anybody else wants to add that we haven't talked about? I mean, I think we've talked about the long process, kind of the agency first, and then the ECI process. We've talked about some different types of onboarding activities like training in person and online, observations, demonstration, mentors, debriefing. So lots of different ways to do that. Kelsey, I see your hand up. What were you going to add?
One thing I'm kind of hearing, and that we didn't really even talk about it because we don't have it in the small programs, is we don't have the structure or the size for the mentor. Mentorship, the formal mentors that some of the bigger programs, it sounds like they're talking about how they kind of have this process of, you know, the supervisor is training the employee, and then they're able to kind of hand them down to a mentor who, you know, they're paired with, who is really helping them on the, you know, the ground. And in our small program, we don't have that. I'm the EIS supervisor, and I am it. And so
You are the mentor. Yeah.
yeah, I think that, you know, adds a layer to it, that we just don't, that I think is a great advantage for big programs that have multiple people that can check in with that new employee and kind of fill in some of the gaps that they have that they can't always make it back to me for. And I think that can be kind of one of the difficult parts of having such a small program is it's just me, or it's just Charlesy, and it's hard, you know, there's not someone that's out, you know, out in the field with them, you know, daily or week, you know, things like that, that can help them the same way.
Yeah, that's a great point. Like capacity within your program really does make a difference in what you can just juggle and what you can manage and what people have access to with onboarding. So I hear you about that, Kelsey. And it is a nice thing to have, and Elizabeth can speak to this better than I can, but mentorship is such a powerful learning tool across time with support, with that debriefing somebody mentioned. You're probably doing some of that, Kelsey, and your role is like kind of playing both of them, but to be able to share that role with someone else, there's a lot of benefits to the supervisor, but also, like you said, to the person who's being mentored by other people. So I hear you that that's not always possible in different programs. I don't know, Elizabeth, if you want to add anything else before I jump us back to the slides.
No, but I'm glad you brought that up because from a standpoint, it is important because someone who is supervising and also trying to serve as a mentor, like we know from the research that often that doesn't always work out well because ultimately the individual knows that you're the supervisor and the mentor is supposed to be that kind of safe individual where they can be vulnerable to say, okay, I know I went through this training, but I have no idea what she just said for the last 3 days. I need to, you know, and when those people in small programs are one and the same, it can be very tough to roll differential to create the context for people to really thrive and feeling safe and confident as they build their competence.
Yeah. And I think when you're in a situation like Kelsey, you do your best, like you do your best in that situation. So yeah, I've worked in tiny programs and big, well, not even, probably not as big as some of the programs you guys have talked about, but Kelsey, where like we had multiple roles, you know, you might be the supervisor and you're seeing a group of families and you're doing assessments and we're helping staff. It can be a lot to juggle. Well, I'm going to bring us back to our slides. I appreciate that discussion, guys, and we're going to keep going with it. So you're going to see my screen shared again. And let's talk about this because you've actually brought up some of where we are headed, which is why onboarding can be hard. We know that onboarding is actually the #1 component of managing employees that can be overlooked by organizations. And I think if we've already talked a little bit about why that can be hard, right? It can be time intensive, it can be resource intensive. Kind of like Kelsey was just talking about, our staff are resources and your time is a resource. So sometimes it can be time and resource intensive because you don't have enough time or you don't have enough resources to do it maybe the way you would like to do. Time can also be a challenge because we need to get people up and going and productive and working with families as soon as possible. Onboarding is most effective when it's actually personalized, which is a hard one because you've got to go to the trainings, take the online stuff. Personalizing probably does lean more towards the mentoring and even if it's just reflection and feedback, you know, some kind of support like that while people are learning the job. I'll tell you, we've talked about generational differences in our work. Personalizing your onboarding, actually your hiring and recruitment and retention process is becoming especially relevant with our younger generations. Not that it's not important to personalize for everyone, but there might be when you can personalize it, you might be more likely to retain some of the folks that's just they're an evolving perspective on the way we're thinking about how to interact with our jobs. And then onboarding can be hard to measure if it's working. Like we can measure the productivity hours, and we can measure how many people we hire and how many people stayed, but figuring out the impact of onboarding and your retention can be hard to measure. So sometimes it can be hard for folks to justify spending the time there. But we think about what we would like to do for onboarding. We can think about 4 overarching goals for a successful onboarding process, and we've talked about some of these. Onboarding should make it easier for employees to integrate into the program. But like you guys have just talked about all the components and the length of time for onboarding. Onboarding can feel like it's not so easy for us, especially in leadership, trying to do this when you're onboarding 3 or 4 different people starting at different time too. But ultimately, our onboarding processes are often, they're time intensive, but we want it to make it easier for the person to become part of the program. Onboarding should create positive perceptions of the program. So we don't want to be onboarding people saying, oh, we've got all this paperwork and you're going to be expected to see a gazillion families a week and all that stuff that sometimes we vent to each other or staff into each other. We want folks to get onboarded to develop their love for this work, which helps them stay. We do want to help a staff get to where they're achieving that performance, as an effective performance, as quickly as possible. And of course, number 4 is what it's kind of been about in our series and our work, like Elizabeth mentioned before, helping people stay, decreasing the likelihood that they'll leave. So there's some evidence that suggests that when you have a structured onboarding system, that is associated with better retention. So we're going to walk through the components of a structured onboarding system. What I would love for you to do is take a moment to reflect on which of these components you already have in place and maybe which you would like to strengthen or add to your system. And I hear you that some parts of your onboarding you may not have control over. They might be agency level stuff. Some you might have control over. And Elizabeth's going to talk a little bit about that, of like we can control what we can control. So reflect on where you see opportunities with what we're talking about. Remembering that we do know there are large and small programs. So even like what Kelsey brought up, it's not a judgment that Kelsey's not doing something that's important. You do the best you can, but it's good to have the knowledge to think about, are there any things I can tweak that I'd like to do differently? I mean, that's really what learning and reflection are all about. So we want to think about onboarding process that includes organizational, manager, and coworker welcoming. So what you guys were talking about, your program sounds like organizational and manager welcoming are probably in place. Coworker welcoming is actually the component of that one that's least likely to be in place, an organized way. This could be having lunch, everybody gets together for lunch to welcome the new people, or you pair somebody up with a colleague that they're able to connect with for support, whether it's true mentoring or just here's somebody to ask your questions. But coworker welcoming was found to actually be really impactful on creating that positive perception of the program and that loyalty that I mentioned earlier. Of course, the second one sounds familiar, providing information about the mission, the value, and the culture of the program. Early intervention is an odd situation, right? It's often people talk about it's own culture within the broader cultures. So helping folks that maybe come from a different culture, maybe more medical based, or maybe they were a preschool teacher coming from a school system, different cultures, different ways of interacting with families, with clients, students, children. So we want to help them understand how do we work within early intervention with the families we serve. And then of course, having a clear understanding and expectation of roles, responsibilities, expectations. And that last one, well, I would almost say probably could look at all of these, but that last one is going to have to be visited at the beginning and revisited across time, kind of like Elizabeth and Charles were talking about. You just can't absorb it all in the first week or 2 of work, and you don't have context yet. So make sure that's one we're revisiting across time. We also want to be thinking about encouraging social connections and a sense of belonging with our new staff. So I'm going to pause here. What are some of the ways you and your agency encourage that sense of belonging, social connections with new hires and the rest of your staff? What are some things you're doing to encourage those social connections and sense of belonging? Any ideas come to mind? Like, do you run a community of practice for maybe new staff? Or is it as simple as let's go out to lunch once a week and see how you're doing? Which isn't always simple because like schedules and all. But what kind of things are your program doing for the sense of belonging? Anything come to mind? You're welcome to drop it in the chat or unmute, whatever's easier.
I think this is something that we can improve as I'm reflecting on that, we have cohorts within our training resource center, but we don't do a great job, I think, of bringing a staff that's really remote, it's remote locations. One of the things we've changed is to have people coming in more for team meeting and to offer opportunities for teaming. But the reality is that's very challenging. Our team is primarily in the field. So, that's something that we probably need to focus on and figure out a better way of increasing the social connection between our employees, especially in, like I said, in those remote areas.
Yeah, thank you, Jennifer, for sharing that. I hadn't thought about like the remote areas where I was thinking one of the things that popped into my head was all the folks working remotely, telework, or maybe you have a large area that you cover. So you have staff all over the place. So similar, I think it's similar what you were thinking, like, how do we keep people connected in what can feel like kind of an isolated job where you're just out in the field, you're doing your thing, and you maybe don't have an office where you get to come in and chat with people in the same, room of cubbies or cubicles or whatever. So I love it that you're reflecting on that and thinking about that. One strategy that I've heard, and I know next webinar, we're going to talk more about strategies, but there's a big program here in Virginia and they use Teams. And so they have Teams chats and things where folks can at least pop in. It's still virtual. It's still not a face-to-face kind of, but people can pop in and say, I'm really struggling in this situation. What do you guys got? And people will jump in with suggestions. So they were leveraging some texting and some online access, which people are already in there, to try to help facilitate those connections. So, but Crystal says she uses Teams for that as well. So, I've heard of people also doing like book studies, virtual clubs and stuff, which are fun, but sometimes people are like, or I can see a family. So it's scheduling and prioritizing time can be a challenge sometimes too. But along with the social connections comes that open communication and accessible support. So like using Teams. The last one here is involving new employees in meaningful work from the beginning. This one was really interesting to me because we do have these long processes. We have credentials or certifications. We have to, like Virginia has a certification process. I know you guys have trainings, hours worth of trainings that your folks have to complete. So how do we balance that? We get them involved in meaningful work so they start to have that sense of identity with the program while also completing all this other stuff. So that can be tricky. That can be something to think about and to balance because people are often ready to go, but we want them to be ready to go with working with families when they truly are ready. So that one I think is just something to think a little more about. Let's see, Nikki said, we started using Teams groups more during COVID and have kept them going to help staff stay connected. And Crystal's doing gatherings at the office, to celebrate National Ice Cream Day or Donut Day. Crystal, that sounds fantastic. I would show up for that. I love that. That's a great idea because that makes it fun rather than let's come in and not that a staff meeting, I mean, it is possible to have a fun staff meeting. I know that's kind of hard to believe, but it is possible. But when you add ice cream or donuts, it's like you feed them, they will come. So I love that idea. Well, I'm going to turn it over to Elizabeth, and she's going to take us through, help you think through some of the other big picture requirements that affect your onboarding process.
So kind of an underlining thing that we're doing here today is just sharing the information and creating a context for you to be able to reflect and then target yourself meaningful things that are within the realm of your, if you will, sphere of influence of things that you can possibly grow and improve on, or pause to go, yay, we're doing some things good, because we've got to stop to praise yourself as well. So Dana just shared with us these 6 pieces or recommended components of a structured onboarding system. And, it's kind of like that equation. It's like, it's the sum of the parts that are actually very important. And one thing when we were preparing for this and when we reflected on some of our previous dialogues with many of you that frequently came up were requirements. So when we're designing an onboarding system, we want to be mindful of these best practices, but we're also often guided by specific requirements. And so what we did was we just went to some of the state information to kind of look at, so what are the requirements? And the requirements inside and out and better than us. But that 3-part orientation. They have to do the making it work. They have to do the self-assessment. They have to create the IPD P, right? And that this is all scaffolded, what we're hearing from you over that initial induction process. We also, with regards to some additional requirements, are, reviewing and signing the code of ethics, completing the 40 clock hours of work. Part of that has to do with their credentialing. So in thinking about what the state requirements are and the agency, because then there's another level, if you will, of requirements that really shape your ultimate onboarding system. We heard, oh, I can't remember who said it. I'm looking back at my notes. Kelsey, had shared that they have like a 6-week onboarding process that's like completely lined out. And so they have a structure and they have practices within that that adhere to state requirements, agency requirements, and then also try to take into consideration that gradual release of responsibility and helping the individual build their identity, if you will, as an EIS provider. But we also heard that in some of your conversations, you share that ultimately, whether it's 1 month, 2 months, 3 months, that you're trying to build towards aligning with state required performance measurements. And so it sounds like there's some flexibility there. Would anyone like to chime in or either in the chat or verbally and elaborate on what are some of those state required performance measurements that you're trying to ultimately build people to independently engage in? What are the state required performance measurements for the actual work?
Dr. Beavers, this is Chelsea again.
Yes.
Since no one's commenting yet, I don't want to keep talking, but I can tell you that just to add to the making it work, there's also a family-centered case management module that has to be completed if anyone has a dual role, such as an EIS and service coordinator, or if your program has designated service coordinators, that there's some duplication within that and the making it work. However, it really has a totally different focus on case management versus delivery of developmental services. But many of our new staff have to go through both of those, as well as, I think, the bigger fish that we're frying right now is the coaching model. Learning the coaching model, implementing, and then documenting all of that is an ongoing, definitely a process, but there's a module that you begin with, and I think then each program develops their own supporting kind of education around that, as well as supervision, mentoring, and that type of thing. But those are the things that really strike me as being requirements and, another learning curve when new employees begin.
So what I'm hearing is, in addition to what we have on here, there's other things. There's additional modules and trainings that are a part of the onboarding that have to be completed, right? And then in this process, in these meeting the state required things, once they complete it, you then jump into the IPDP process, which is kind of reflecting. So I've met credentials, I've learned, now how am I going to continue my learning, correct?
Correct.
And at the same time, that is then when they are building towards state required performance measures and agency requirements for caseload. So we saw some variations in the initial discussion, 50% of their time by this month, by third month, and then we still we scaffold and build. I wanted to take a moment just to highlight, if you will, these requirements again, because Dana shared the structure, 6 elements that are critical to structuring and designing an onboarding system. And the guiding piece of this is this ever mindfulness of what are the requirements that are part of that. So what we're going to do, if you will, next is we're going to engage in a little bit more discussion about essentially how those requirements align, if you will, or hinder some of the onboarding, recruiting, retaining work that we do. So specifically, one of the first things that we're going to talk about is like what you think works really well, mindful of what Dana shared, mindful of the requirements, what works really, really well at both the state and agency level. And then we're going to talk next, if you will, about some of the challenges. But as we're engaging in this dialogue about what works well and some of the challenges, we have created a Jamboard that that we want to try to capture some of what you're sharing. So Dana is going to pull up the Jamboard, and Angie's going to, this is like orchestra coordination here going on. So on the Jamboard, what you can do is you'll come over to the little the little sticky note. Where is it? Yep. Where Dana's thing is. And so when you're thinking about your onboarding requirements and the things that align well, if you will, put a sticky note on, for example, one thing that might align well is the scaffolded training. Like you have a system in place that really allows for those reiterations or the scaffolded training. And you'll create a sticky note and you'll just move it over to the aligned side. And then after we share out and discuss some of those things that work well, we're going to also talk about some of the things in our system that hinder, and what are things either with the state or our agencies that are opportunities to really better align what we do and grow what we do, so that ultimately when we are onboarding individuals, we are creating, if you will, that social component, that safe emotional component where people want to stay. All right. So we're going to allow you to log in and be adding some of this, but in the meantime, I want to open the floor if anyone wants to verbally share what are some of the things that you perceive work really well in your work in terms of onboarding new employees, considering either the state or agency requirements. What works really well?
Elizabeth, do you want me to scroll through the Jamboard for those two, or just leave it on this page while folks are putting it in?
You can leave it on this page while people are putting in, because the stories that go with the stickies, we did this. This is how we came to this. I think, again, there's much value to learn what others are doing that work well, that reinforce our efforts or provide an opportunity for us to get new ideas.
Yeah, and I think hinder can be like, I think Jennifer was talking before, things that you're reflecting on, you think, well, I don't have that in place yet. So because I don't have that in place, that could be making it harder for this to happen, make it harder for the social connections to happen. So under hinder, it doesn't necessarily, I hope you guys will hear us. It's not like a judgment that you're not doing something you should. It's more of a reflection on, oh, or maybe my agency does this thing that could make it harder for my staff to meet these requirements.
Mm-hmm. So while some of you are making comments, if anyone wants to verbally, universal design here, we want to provide multiple means of opportunities for you to share on the Jamboard or verbally share what are things that you feel like work really well with onboarding, either from the initial small group discussion or now that you've reflected a little bit on some of the information shared.
And I was going to add, Elizabeth, in case anybody's having trouble accessing Jamboard, if you want to drop your comment in the chat and just let me know if it's align or hinder, I can try to move it and put it on the Jamboard for you. So you have your chat as a backup too. I can tell you, Elizabeth, in my state, one of the things that I hear sometimes I would probably go on the hinder side would be feeling the rush to have folks seeing families when we don't have enough staff, or we're having a staff shortage, or we have, you know, I mean, none of us are allowed to have a waiting list. It's just like illegal in Part C terms, but sometimes there are kids waiting to be seen because we haven't had a speech therapist, and that sort of sense of responsibility to families and to making sure that people are getting what they need I don't know if it's hinder, maybe it can just make it harder to juggle all the requirements. It's not that they don't get juggled, but it can just feel like an added weight on that supervisor in that program to try to get all of that done when we know families are waiting.
Yeah. That kind of goes back to the question I posed about what are the state required performance measurements. So we internally don't want families waiting to receive the services that they need. We finally hired some people. We got to hurry up and get them ready to relieve some of the workload of others before we lose more people. But then we're also mindful of, you know, the performance measurements. What are they looking for?
And quality too. You know, I think it's often a juggle in early intervention to meet the requirements, because the requirements are there for a reason. Sometimes where it's like, why do we have more requirements? It's making me crazy, but they're there for a reason. And it's usually to make sure families are getting quality services. So how do we make sure that the services are actually quality when, like somebody wrote here, juggling so many things to give proper time needed for staff training? That's a reality, right? When you have there's only so much time, but we're trying to meet the requirements, make sure quality services are happening. It's a lot that leaders are juggling.
Well, and you know, there's a lot that leaders are juggling, and in aligning, going back to some of that, we heard many people in the beginning when they reported out about what they're doing, creating that system structure so that when you hire someone, I need to scroll names. I think it was Rhonda. She's shared with us, I think, a few times, like they have a process and they're able to clearly articulate to someone upon hire, here's what the process is going to be. You're going to do this, you're going to do that. And that in and of itself allows, in my mind, it allows with expectations, because it lets someone see, okay, I'm not working with families tomorrow. They care enough about me that there's this process, 6 weeks, however long, and have that journey very clearly in front of them. So sometimes, you know, people get hired. It's like, I don't know, I'm doing this and then I'm doing that. And I don't know when I'm going to start seeing families.
Yeah, for sure. I know we have a program leader in our state who is like the checklist queen. Everybody says, if you need a checklist for any part of EI, go to her. But she develops these really detailed processes, all the expectations. And I think it can be really helpful when you're trying to learn the job, but it can also be really overwhelming to see a 6-page checklist for transition or whatever, you know? So it's like helping people figuring out how they receive information, but having it spelled out in a way it can be digested is important too. I love it that we have a lot of stuff popping up, and it's a lot of good things that you guys are doing, which is awesome.
Right. So back to some of those positive things that people are doing well. I want to give an opportunity to see if anyone wants to elaborate and share out about maybe one of the things that they've put up, because the clear schedule, there's so many good things clearly happening intentionally. Does anyone want to share what they're particularly proud of? Or has anyone made a recent change to evolve what they're doing that they're really proud of and is working well?
I mean, I could share a lot of what we're proud of and stuff, but to comment on the first thing you said, I think it's a fine line with, like, I really like how we have a mentor for our new hires. We really try to select mentors and pals that really are exceeding all job expectations, right? I mean, they are just like, they're not supervisors, they're direct service staff. And so they're really, just blowing and going, plan versus delivered and collaborative documentation, and they've finished their IPDP, all the things. So sometimes I think that, it's a good thing, but then it can hinder in the end of, trying to individualize with personalities and different things at times. And then I really like how we have a schedule and clear cut, trying to get people finished so they can pick up clients when we need them to. I mean, number one, with the requirements of the state, but I mean, there's a component of kids can't be waiting, families can't be waiting, and we have to bring in revenue. I mean, everybody, I'm sure understands that aspect as well. So it's kind of hard to individualize it because we are on pretty strict timelines, really, to get them up and going, not only because the state, but I mean, that component of our program, especially if we're at a point where we're bringing in a bunch of new hires at the same time. If it's kind of over and above, which I feel like that really never happens, but let's pretend that there's a time when it happens, that might be different. But I don't know. I see that where it could fit both align and hinder.
Yeah. No, I appreciate you sharing that. And you're another. I mean, at the ECI Summit, I think year before last, you were on the panel and you shared a lot about your onboarding, because I know that your program has worked extensively to build a pretty comprehensive program. So I appreciate you sharing that. So let me just put it out there. Anyone else want to share something going well that really aligns, that they want to highlight? Okay. Well, we see the Jamboard. We see that there are lots of things going well. We also know that our pinch points, if you will, often lie in the things that hinder. And it was important for us to have these next to each other, because what might be hindering for one individual looking at works well and aligns well in another, you might therein see a challenge and a solution right next to one another. However, the challenges are real, and as you just shared, one of the key, Anisha, one of the key things is identifying those specific pinch points. And so I'm going to ask if someone would please elaborate on, for example, lots of agency expectations and training. Can you share a little bit? Is anyone willing to share a little bit about that context? Because we know too much front loading, you're just going to have to redo it anyway. Adult learning, any learning will tell us that. So a disalignment or hindrance, lots of agency expectations. Can anyone elaborate a little bit more on that? And potentially where there might be opportunities to, I don't know, evolve? So to be clear, some people work within larger, like a behavioral health center or a larger agency. So even in our small group, like they were talking about, okay, well, our agency does a whole 4 or 5 days of training just themselves on the agency before they even get to learning about ECI. Is that kind of the context of that comment? I'm curious. Somebody can say yes or something in the chat.
Yeah, I think that was me, and maybe I know it was maybe Tanya from another behavioral health center.
Okay.
I don't think theirs is quite as lengthy as ours, but the way I've looked at that, I suppose, is that it's great to get some of that, frankly, out of the way before they get into the ECI piece of things, because those are things that are required here by the agency and have to happen. And it's too difficult later on to get them. They're seeing families and kids if you wait too long to do all of that, and then it becomes almost impossible to get that training done. And what I have done is to meet with the HR director here and tried to better individualize some of those trainings for the ECI staff so that we're not doing trainings that we don't need to do our jobs. And I think we still have some of that we could fine tune a little bit better, but there's a good start on that. And it's great for them, like I said, to get that out of the way a bit and not have to worry about that, so that when they get to ECI, they can really focus on what they need to do every day. Well, some of the comments that I've heard from staff are that they don't really recollect what they've seen. They, they think they've heard it or seen it somewhere, but they can't remember what it was in reference to. So there is an overload, I think, initially, that is maybe counterproductive or not conducive to retention, I think is what I put. But that's why we do annual trainings on many of those things as well. So it's almost like a necessity of sorts, that I feel like we try to handle as well as we can. But it is a great deal of online training between the agency and ECI's training. It's an enormous amount of training.
Which that is a good thing, because most of the people coming into this, if maybe they came from physical therapy or some occupational therapy and a medical model, and now they're coming into a family systems perspective or an early interventionist who have taken coursework and maybe did one observation or practicum experience. So the training piece is important and can't be understated, but we can control the scaffolding of that. And to that point, when we're looking at what aligns well, when we're looking at the things that kind of hinder the success of onboarding individuals in such a manner that's ever mindful that our goal here is to retain them. We don't want to invest 3 months or 6 months, and then as soon as they get their caseload, they walk out the door because they were like, it was just, it was too much, right? So we want to look at those aligns wells and those hinders, if you will, and at our program or agency level, you know, we really want to think about, if you will, this is one of my personal mantras. You can only control what you can control. And in that, it's not to make an excuse, it's to say, what can I control? So when I look at what's going well, are there ways that I can, you know, heed some of the guidance, and continue to evolve something in such a way that not only am I doing the organizational and manager stuff well, but there's an opportunity for me to, from the get-go, begin to connect the employee with the people they're going to be working with, not wait 2 or 3 weeks before they're actually meeting some of the people. What can I control? What can I do? And then those things that are pinch points, be ever mindful of what can I advocate. So Charlesy, like, can I go to my agency and say, look, we have, I don't know, I'm going to make something up. We have data that shows that we're losing new people at 2 months, and exit interviews show us that, like, they're not connected to the work or they're overwhelmed. So how can we, agency and program, work together to chunk and scaffold? What's the priority? You know, can we take advice from programs that are working well, like Amisha, and maybe come up with something? So to that point, I just want to put out there, and you can say or put in the chat, but when you think about this perspective of you can only control what you can control, but there are a lot of things that you can control, and there's some that you can't. What would you change about your onboarding? Like, if you had to name it, what are some of the specific things that you would change? And if you will, put some of these in the chat. And very related, what would you improve? What would improvements to the onboarding process look like? So we identified good things. We identified hindrances, challenges, opportunities. So now if you had like this little magic wand, and could zap, what would be some of those things that you would change, or what would be some of those improvements that you would actually make? I want to encourage you to document some of those in the chat. I don't know what I did to make my chat so big. Again, I can't see the screen. Talking to myself.
Elizabeth, do you need me to read what's in chat? I can read it.
Yeah, for some reason, when I see that, yeah, it's taking away. And that, Dana's, will be a great segment then to kind of.
Okay. Oh, okay. Yeah. To wrap us up. So Morgan says, I would like for us to have a more set schedule for new staff and just an overall more organized training process. And Nikki's kind of similar, create more structure for our training process. So that idea of structure, kind of, that increases the that people have an understanding of what's expected, probably would make it easier for them to onboard, right? Which was one of our goals. So Nikki and Morgan, I think those are great places to start. And so those are great examples of something we'd encourage you guys to be thinking about between now and the 19th, our next webinar, because we're going to be talking about some strategies like that, like sort of like the what next, what kind of strategies are out there that can help us do this even better. Jennifer says more opportunities for mentoring in our remote areas. So that's a great thing to be thinking about. And like, what would that look like? Is it virtual mentoring? Is there a way for people to meet up somewhere? Yeah, Jennifer, there's probably some logistics to think about with that, I would imagine. What else? Any other thoughts you guys have? Or you might be something you need to think on. You might need to, I don't know, it's 1:30 here. I was gonna say you might need to get lunch if your brain is like on the way down. Your blood sugar is, I know that's mine. It's a wonder that I'm making sense. Hopefully I am. But let's keep going. So I would love for you guys to keep thinking about this. If you put it in chat, wonderful. If you don't, drop it somewhere that you can see it. I still use a lot of sticky notes even outside of Jamboard. Put it in your device to pop up maybe next week or the week after to help you keep thinking about this. What are we doing well? What do we want to, how can I improve this? Because I think with EI, there's almost never like a perfect process or a place where we get to where you think, I've got it. It's finally fine. It's finally great. There's always another way to make it a little bit better. And that's one of the equally sometimes frustrating, but I think kind of exciting things about EI is you can't do this work without growing. So with that in mind, we want you to just to keep thinking about how your ideas for improving your process, what is the thing you might be able to control, or even with the umbrella thing, I can control the state requirements or I can control the performance measures, but is there something within your process you could tweak to make it easier to meet those? Like that's where we want you to be thinking about the different levels of what has to happen, sort of the have to do's, and how can I make that a little easier, a little less painless, or a little, no, that was not the right word, less painful, and make it a little easier for everybody involved. So these ideas here are your structured organizational process. So these come from what we talked about before. So what I want to do is ask you to do one final tool on your slides. I'm going to ask you to use your annotation tool and drop a stamp on any of these ideas that you think your work, your onboarding process is already aligning with pretty well. So the way you access that is you're going to hover your cursor at the top of your screen where you see viewing, it probably says viewing Dana's screen or viewing options, something like that. You'll hit the downward caret. It'll bring a drop down menu. And I want you to look for the word annotate. When you click annotate, an annotation toolbar will pop up on the left of your screen. And you can pick the check mark, which is the stamp. You can pick any of the stamps. There's a star. I'll drop a star so you can see it. So I dropped a star on includes organization. So just pick a stamp you can write on the screen and let us know where do you think your ideas align pretty well with these structured components. You always have chat as a backup. So we have a couple people popping in. Awesome. I got to move my stuff around because they're up and everywhere. It clearly explains roles and responsibilities is getting a lot. That's awesome. Providing information about mission, values, and culture. Involving new employees in meaningful work from the beginning. Prioritizing open communication and accessible support. That one I think is like natural to us as early interventionists, right? Open communication and accessible support. We want our providers to give that to families. So it makes sense that leaders would do that as well. Lots of great comments here. Includes organizational manager and coworker welcoming. I love that you guys got that. So I'm seeing stars and checks everywhere, which is awesome. I'm going to clear the screen. So you're going to see everything drop. Clear all the drawings. Now drop your marker on something you think this is a place where maybe we could improve. This is one I want to keep thinking about over the, before we meet next time. Where's something you think you could strengthen in your program? I know we talked a little bit about encouraging that social connection before. Accessible support, social connection, sense of belonging, involving them in work from the beginning. Explaining the expectations, that coworker welcoming. So I love it that you guys are dropping your check marks on the specific components of each of these, because that tells me you're really reflecting at that deeper level. Like this piece of it is one I want to pay attention to. All right, so that encouraging social connection seems to be like the winner. That seems like that has several. So keep thinking about it, guys. I'm going to go ahead and clear the screen, and we're going to keep thinking about that. Actually, you know what, I'm going to take Elizabeth or Angie, do you guys mind taking a screenshot of this? That way we can just remember, we'll remember when we're planning for next time. Thank you. All right, I'm clearing the screen and let's wrap it up. You can X out of your annotation tool by clicking the red X at the bottom, or you can keep dropping all kinds of stuff on the screen. That's awesome too. So to wrap us up, I love quotes. So employee retention, which we've talked about so much across the years of this project. I loved this, that it's not about preventing people from leaving, even though it can feel like that. It's really about giving them reasons to stay and helping create a culture from the beginning, from your recruitment and your onboarding, can have a big impact on helping people want to stay in what we all know is a fantastic career. So with that, we hope you'll join us in August. Our next session is August 11th, 11 Central, 11 to 12:30. And we're going to dive into more strategies, best practice for recruitment and retention. So we'll take some of what we've talked about today and share some additional strategies and just have a discussion. I would love to hear from you too, what you've thought about since between this session and August 19th. What have you noticed? Maybe if there's anything you've tweaked in your process, we'll talk about it next time.